Let's look at some patient safety goals. These are WHO patient safety goals. In fact, if you're a healthcare worker, you're supposed to be working with these patient safety goals in order for us to feel safe. So one is identify patients correctly. This goal is supposed to be met. People use bed names, people use ward names to identify some patients, but the hospital can decide of correct identifiers. Like you want surname and date of birth, you want MR number or identification numbers peculiar to the hospital and date of birth. I mean, a hospital can come out with these two identifiers so that we don't make mistakes in exchanging drugs, exchanging lab samples, ensuring that you are giving the patient the correct medication. These are all checks and balances for identifying patients correctly. Improve effective communication is the next one. Improving effective communication is how we give information to patients and staff. So one way is now we have a lot of digital platforms. We have a lot of use of flyers. You can use the digital platform, you can use flyers, but the communication should be clear. Improve safety alert medications. These ones are tagged medications that sound alike and look alike. Some of the medications we have in Ghana here are the boxes look alike, the color on the boxes look alike, the sounds, the way we mention them look alike. So you give people alerts so that we prevent ourselves from getting the patient harm, and also the staff from giving that kind of medication, wrong medication to the patient. The next one is correct side of procedures. I know of cases where people are supposed to have surgeries on their left hand and it goes to their right. They are supposed to cut the one leg and it goes to the other. By the time you realize you are doing both, one breast, left breast, and you are going to right breast. So this is identifying correct side. Reduce the risk of healthcare associated infection is the next, the fifth goal. The healthcare associated infections are prevented in the hospital. There are infections that you get when you come on admission at the hospital. So we have to make sure that patients come into the hospital and feel better than when they came. So we don't give them hospital-acquired infection. And with this, there are some steps that we have to take in order for us to be able to achieve that. The last one is reducing the risk of patient harm of falls. Fall is another goal. People come into the hospital and say, oh, they just slipped. But there are certain things that we can put in place, initiatives and strategies that we can do just to prevent people from falling. It's not okay for people to come into the hospital and fall, whether from bed, whether from side rails, whether from stairs, whether from slides. They shouldn't fall. So these are the 6 goals that we are talking about on patient safety, and we need strategies